Okay, we can breathe easy. 7 minutes are up. So this next company hails from Durham, North Carolina, and they're poised to take advantage of an enormous shift, the consumerization of healthcare. I want to welcome Medlio.
Thank you, Elliot. Hi, my name is Dave Brooks. I've spent most of the last 13 years working in healthcare IT, primarily in the areas of mobile and digital technology. But over the last 8 years or so, I've also had the opportunity to start and build a successful primary care medical practice. And during that time, I've learned a couple things about collecting money from patients. One, it's incredibly difficult. In fact, it's downright painful. Two, the point at which you attempt to collect money has a major impact on your chances of being successful. Recent research breaks this down by the numbers. If you collect from a patient on the front end of a visit, you have an 80% or greater chance of succeeding. If you wait just until the time the patient is checking out, your probability of success falls to 50 to 70%. And finally, if you let the patient leave the visit and attempt to bill afterwards, the chances of collecting the money plummets below 40%. In fact, separate research by McKinsey places this number at 19%. So, as bad as and as shocking as these numbers are, the truth is that until recently, this hasn't been that big of a problem. In 2000, for example, patients only paid about 5% of the total bill, and most of that was in the form of co-pays, which are relatively easy to collect on the front end of a visit. If you fast forward to today, patients now are responsible for more than 30%, and most of that, the bulk of which, is in the form of difficult to determine deductible and coinsurance balances. So let's be clear about what's happening here. Not only is overall patient responsibility growing rapidly, but the component that's difficult to collect on the front end, namely deductible and coinsurance balances, is dominating that growth, courtesy to the meteoric rise of high deductible health plans. Without tools and processes to help doctors estimate costs on the front of these visits, they have almost no choice but to see the patient, bill insurance, wait for adjudication, and then begin futilely sending out patient statements. So this is what the net effect is for the typical doctor over the last few years. While top-line charges have steadily been growing year over year, patient responsibility has been growing faster. And when you factor in how much of that is actually collectible because of a lack of adequate tools, you see they have a declining revenue stream. So how much is at risk? Over $116 billion in out-of-pocket responsibility for office visits alone. We think this is a problem worth solving, which is why we created Medlio. Medlio not only gets doctors paid, it engages patients in the process and begins to transform the entire consumer experience. Here's how it works. Meet Mary and her Dr. Steve. The next time Mary calls to schedule an appointment, Dr. Steve sends her a text message with a link to the Medlio application. After she installs the application and creates a secure account, she enters her insurance and medical forms data. When she arrives at her appointment, she checks in from her phone, and in that process, she securely transfers the insurance and medical forms data to Dr. Steve's front office manager, Rachel. Rachel verifies the insurance, notes any changes to the form, and then, using 3 key pieces of information: the plan benefits, the payer-specific contracted rates, and the reason for visit, she calculates an estimate, which she then sends to Mary for review and payment. By paying from the application, Mary receives a 5% early pay discount by Dr. Steve. Additionally, the receipt for this visit, as well as all other receipts for healthcare payments that she spends during the year, are captured and stored for later reimbursement and tax filing purposes. It's that easy. Medlio replaces Dr. Steve's existing merchant services with a more efficient and cost-effective solution. There is no charge for the software. We make our money on a transactional basis. In other words, we get paid when Dr. Steve gets paid. So it's important to note, patients do not have to use the smartphone application in order for the provider solution to work. We intentionally designed the solution for both components to operate independently. This allows us to create value for both, while at the same time turning our early customers into our greatest champions. In the process of addressing this immense problem, we're bringing the 3 key stakeholders onto a single secure platform. From here, the possibilities going forward are endless. This is the Medlio team. I wish I had time to go into everybody's background, but it's an incredibly talented and well-balanced group. It's been my tremendous honor to work with them, as well as our advisors, mentors, and extended team not listed here. We've accomplished some incredible things since starting this journey in January. I would like to give special thanks to DreamIt Ventures, Penn Medicine, and Independence Blue Cross for making the last 4 months possible. The opportunity our team has had to work together continuously around the clock, while no doubt trying at times, has allowed us to accomplish our early goals incredibly quickly. Since January, we've completed and deployed our benefits processing engine and have started testing our provider application in our first office, which is part of a 32-practice IPA and ACO. Later next month, we'll be launching our mobile patient application into private beta testing. While our time at DreamIt is coming to a close, we are, of course, continuing the journey. We recently began working on a seed round, and I strongly encourage anybody who's interested in joining us on this journey to please stop by our table after the presentations are finished. Thank you very much for your time.